Let's talk about Berkson bias. Berkson was a statistician in 1940 who first described this concept. So let's talk what is this. Let's take an example. Let's say a resident is wanting to estimate the odds of pantoprazole use among bladder cancer subjects and among non-bladder cancer subjects. So he wants to study what is the odds of use of pantoprazole in bladder cancer cases versus non-bladder cancer cases. Non-bladder cancer means like lung cancer, colorectal cancer. So there are other cancers except bladder cancer. So he estimated the odds ratio to be 0.7. So he found that there was low odds of pantoprazole use among bladder cancer cases compared to non-bladder cancer cases. And he found that there is one population based study in his country, and they have concluded that there is no association between use of pantoprazole and bladder cancer. But he found that odds ratio is 0.7. So why did it occur like that? So this is Berkson bias. You know, in hospital or clinical setting, we use pantoprazole a lot to prevent stress ulcer as a prophylaxis. So due to wide use of pantoprazole, there may be more use of pantoprazole among non-bladder cancer cases and less use of pantoprazole in bladder cancer cases, because in gastric cancer, esophageal cancer, there may be more use of pantoprazole because patients are symptomatic, so they might have used more pantoprazole. So odds ratio has come 0.7. So this bias has occurred because he chose controls from hospital setting. If he had chosen the subjects from the community, from the state where these cases come from, and then he would have compared cases and controls, then he might have concluded that there is no association, right? But since he has chosen controls from hospital setting, this result is biased. So we call it Berkson bias, or hospital admission bias, or sampling bias. This is a type of sampling bias because he took samples, he took controls from hospital records. He did not choose controls from the community where the cases came from. This is what we look when we are selecting controls. We have to be careful. If any bias is occurring in choosing controls, so choosing controls in case control study is really difficult. We have to think a lot.